Dr. On Call, we believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Dr. On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online. So the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Dr. On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.
Hello, everybody. I hope that gave you a really good insight of what Dr. On Call is like and what it's all about. And welcome to our live webinar. My name is Linora. I'm going to play your host for the evening. And today, the topic that we're going to be talking about with Dr. On Call is endometriosis. Don't suffer in science together with Bayer. So what we're talking about today is first to understand what endometriosis is all about, and we also want to encourage you to don't just wonder whether you may have it or not. Actually, take the quiz, which is on the Dr. On Call website, and that's where you can make an appointment with a specialist. Which after you've heard our talk today. So, as I mentioned, my name is Lenora. I am actually a radio host. I'm also a content creator. I'm also a wellness coach, and I'm an ex-bikini bodybuilding athlete. But for today, I'm going to play your host for this entire talk. Now, endometriosis is something which I've also been curious for myself, as some of you may or may not know who follow me on social media. I've heard this thing associated very closely with the term PCOS, which is well, I won't say it's directly closely related, but it is something that I hear a lot. So today we're going to find out more about endometriosis together with the doctor of the evening. Can I please welcome into the show Dr. Navdeep?
Hi,
Hello,
hi,
Doc.
Lenora. Hi, how are you?
I'm doing very well. And yourself?
Good, not too bad. I'm
Fabulous.
fine.
Okay. Before we continue, let me just give a brief introduction about Dr. Navdeep and what he specializes in. Okay, everyone. So, Dr. Navdeep Singh Pannu is a consultant obstetrician, gynecologist, and fertility specialist at TMC Fertility Center. He was previously attached to General Hospitals in Klang, Seremban, Sungai Buloh. Dr. Navdeep is currently the medical director of TMC Fertility. That's where you can see on his background, and is
Yep.
practicing at TMC Fertility and Women's Specialist Center in Puchong. So now that we've got an idea of what Dr. Navdeep, what his background is like, Dr. Navdeep, I think let's dive straight into
Yep.
what exactly is endometriosis.
Well, endometriosis is a medical condition where the inner lining of the womb gets impacted.
Ah, okay. So it seems that we had a slight disconnect
Yeah,
over
I
there.
switch over
I was
there.
already prepared. I was already prepared. Like, okay, let's open Dr.
Okay.
Google.
Yeah, Dr.
Okay.
Google.
All right.
Right.
So coming
So,
back, yes.
I think
What's
I'll start from the
endometriosis?
beginning. Okay. So,
Yes.
endometriosis is basically a medical condition. Affects women in the reproductive age group. Okay. So, it's when the inner lining of the womb gets lodged outside the womb cavity, usually in the pelvis, ovary, fallopian tubes, and also can be on the bowel. So, it generally reacts to all the hormones that women have, and when you have your menstrual bleeds, and those things also, those implants too starts to bleed, and cause scarring, and that causes the pain in women when they have endometriosis.
So
Mm,
basically, because I did a bit of research on it. So in
mm.
a nutshell, it's the same tissue which lines the uterus that is also found outside the uterus. Is that correct? The same tissue.
Ex- exactly. So the theory is basically, when you have your menses, some of the menstrual flow, which has all these cells, will flow through the fallopian tubes and lodge outside your womb. That means on the
Mm,
ovary or in your, the other organs in your body. All right.
okay.
And then that's when it starts to implant and start to grow. So over the years, over time, it'll become a cyst or some collection of old stale blood. That's what happens. That's when women have a lot of pain and all.
Can I ask, how
So
does that even happen? Like, how does the tissue from the outside grow on the outside? Did it just decide to slide there, or it happens to just grow? Is it it's I don't want to say defect, but is it like something that was caused by anything?
well, to be very honest, doctors, scientists, we don't know the true reason why it occurs. There are a lot of theories. One is that retrograde menstruation, where the fluid menstrual flows out the fallopian tube. Another one due to immune response, that some women tend to
Mm,
have a predisposition or the risk to develop it compared to other women. And this
mm.
is usually seen among in families, like some sisters or the mother has, and the daughter has have it too. Okay, so but the other things, like some people talk about, certain hormonal therapies or eating certain foods can cause it, is not true.
Mm. So you are you saying that it most likely is hereditary? It is passed
Yes,
down from.
yes,
Oh,
most likely it
okay,
is. So that's the theory so far.
okay,
Yeah,
okay.
mostly it's immune response. Your body can't clear those cells from the pelvic area, and eventually it starts to
Mm.
grow and cause trouble later.
I see. Your
Mm.
body cannot clear, it's an immune response, and you said the body cannot clear it out.
Yep. Correct. So when you have this blood bleeding through the fallopian tubes and implanting outside your womb cavity, like ovaries, for example, so your body immune system is supposed to clear all those unwanted cells in your body. Sometimes certain patients it doesn't it's not does not clear. So for some reason or another, the the immune response doesn't immune system rather doesn't react towards it and clear it up. So that's when it starts to grow.
When you say clear up, right, doctor, is it clearing up from when you have your menses, or this is clear up from, say, toxins and stuff like that in the body? Because
Well,
it's immune response, right?
correct. Yes, you're absolutely right. So when your body can't clear up something, okay, certain
Hmm.
cells, for example, the endometrial cells, okay, and that's basically mostly immune related. Okay,
Ah.
why do you have that? Nobody knows. Most likely hereditary.
Okay. All right. So now I pretty much understand it better. And so it's a kind of like an immune response, and that's what happens with endometriosis. Okay. So what are the signs and symptoms of endometriosis? The one that I've heard of a lot, doc, is spotting in
Mm.
between periods. Is that true? Is that one of it?
Yes, it's one of it, but not the main one.
Okay.
M- Unfortunately, many women are asymptomatic. That means they don't have symptoms at all. Okay, and only much later in their life then they have all the symptoms. And the common symptoms that pain during the menstrual cycle, known as dysmenorrhea, means every time they have their periods, they have severe pain and all. And the sad thing is that a lot of people are like brushed off and say, "Oh, that's a normal thing during your menses, so it's a
The
normal thing,
PMS thing.
yeah, PMS
Mm,
thing. So don't worry about it." So that's the problem. That's the reason why the endometriosis is it's detected or diagnosed late. Okay, so because the girls are not sent to a doctor for assessments and subsequent treatment. The other
mm,
symptoms with dysmenorrhea, that means pain when you're having intercourse. Okay,
mhm,
painful urination known as dysuria, chronic pelvic pain, the pain which is even at times not related to your menstrual cycle too. The pain this tends to prolong, spotting, and the other thing is that infertility. But 30 to
okay.
50% of women who have endometriosis have difficulty in conceiving. Okay, it's not
Mm.
impossible. You can get many babies, that's for sure. Okay, but it's a bit of a effort in a sense that you have to go for some amount of treatment and specialized treatment, and then you can get your babies.
Okay, all right. So the signs, just to recap what you're saying, some of it is spotting and it's pain,
Yep.
and the major one you said was pain. Is there any other
Yes.
signs uh or symptoms that related with endometriosis?
Well, you also can have swelling, in your on your tummy. You can feel there's a lump or bump over there in the lower part of your tummy. Okay, and that's one reason why lots of women end up going to see a doctor. Some will have fatigue, heavy bleeding during a menstrual cycle, and
Mm,
a lot of girls, especially, I mean, no, young women, they tend to take medical leave or they stay away from school during their menses due to pain and the
mm.
discomfort. They also feel exhausted, fatigue, and all, yeah, weakness. Then they have all that. And if your nerves are affected, then you may have some shooting pain over their thighs and even their
Oh dear.
legs. Okay, so those are the deep-seated type of endometriosis.
Okay. Wow. That's
Mm.
the one thing I took from the whole thing is a lot of pain
Yes, not
from it.
discomfort,
Yeah.
not discomfort with the lower abdomen. Yeah.
Okay. And that's actually, it's a good thing that we're having this chat, right, Doc? Because you mentioned that a lot of people just take the pain during PMS for granted.
Mm.
I mean,
Yeah.
even from myself when I was younger, it just became as an assumption that people say like, oh yeah, it just before your period, you are bound to have some kind of discomfort and ache over there, so it's perfectly normal. I think the part is where when can they know it's normal and not normal? It's an abnormal kind of pain, like how severe would the pain be for a person with endometriosis, and when should they go like, okay, I think I need to go and double check on what's happening here?
Okay. If you require to take medication, painkillers, if you require to
Mm,
take MCs or skip school or skip something, then that's severe enough.
What
Okay.
about that pink Panadol? Does that count as a painkiller or?
Yes, of course. Pink Panadol too is a painkiller too. Is a good painkiller.
Yeah.
Yes, all right. So,
Okay.
but anyone who has to take a lots of medication, painkillers, and their quality of life has been affected. Oh, that's
Mm.
a big red flag or a big sign that look, you got to get it checked.
Okay. All right. I think we covered it just now when we spoke about what are the causes, because you did say that it's predominantly hereditary, right?
Yes.
Okay. And it does not, you did say that it does not have to do with anything to do with foods, the lifestyle that can cause endometriosis.
Well, some people talk about eating certain types of meats, red meat,
Hmm.
chicken, because due to certain things and a certain way they prepare it and all. So, but that's all a myth. Okay, it's not true at
Okay.
all. Okay, so some people talk about eating like what do you call that? Food with high in phytoestrogens, for example, your tofu and things like that. But that's a myth.
Mm,
That's not true at all.
mm,
So basically, end of the day, the risk factors. There's a whole load and list of risk factors you can find from Google. Okay,
mm.
lots of things. But then again, it's not entirely true. So basically, as I said, it probably runs in family. And most importantly, if you have certain severe symptoms, just go and get it checked. Okay, you
Okay.
never know. You have a big cyst sitting down there, which may affect you in the later life.
Mhm. What are there stages of endometriosis? Like, can you get it as young as, I don't know, 15, 16, like when you first get your period? Just walk me through, Dr. Dapi.
Well, endometriosis generally progresses from the lower stage known as minimal, that's stage 1, mild, stage 2, then moderate, stage 3, severe, stage 4. Okay,
Mm,
so when you talk about minimal, it's just like small spots of this endometriotic, cells outside your uterus. Okay, and then it slowly progresses to having a big cyst formation. Okay,
mm,
and then later the severe ones are like huge cysts and your bowel, everything is stuck together, okay, due to something called adhesions. So when inside your tummy, in known as a peritoneal cavity, if you have any surgeries, infection of endometriosis, certain scarring occurs. Unlike in our body, in our skin, we get a scar, okay, but inside
mm.
the scars look like spider webs. Okay, known as
Oh,
adhesion. So your bowel gets stuck, then everything gets stuck. Those are like very, very severe. And the onset is generally occurs on the first time when you have your first menstrual period. So when you're 11 years old, then if you have a higher risk of developing it for some, and then the thing will start to slowly progress as you get older and older. Okay, so generally it
oh,
starts with
okay.
lower stage and all. So how to prevent it? A lot of people talk to me about how to prevent it. Generally, the very fact that we can't predict it is very difficult to prevent it. Okay,
Mm,
but we can generally you can lessen the effects by taking certain painkillers, certain types of medication, which we can discuss about that later.
okay, all right. I see that we got some questions here from the
Ah,
Facebook page, and this is coming from, we'll answer two here. One is from Fazila Ahmad, and she's saying, I have had my period for 1 month, but it only comes out a little. Is this dangerous?
well, it's the first answer is not dangerous. Some women tend to have lighter menses compared to the others. I got some patients. It's normal for them to bleed one day. Very normal. They've been having it for their whole life, and it's common. Regular cycles and not and normal. Okay, some people bleed but 7 days, so it's normal for them. Okay,
Mm,
so um, period for one period. I had period for 1 month and it comes a little. Sorry, they said 1 month. Yeah, sorry, I read it at 1 day. Okay,
okay.
1 month.
Yeah.
Okay, period for 1 month, prolonged 1 month. Yes, it's a problem. You have to get it
Mm,
checked because you might have endometriosis, you may have polyps, you may have some growths in your womb lining or your cervix. So it's something which you need to go
mm.
and see a gynecologist to get an ultrasound scan, get a pap smear done, and to check whether you have any growth growing inside or not.
Okay. Doc, then this is one I want to ask, right? Okay, say, because I've heard from friends where they spot. Now, what is a reasonable duration to spot for the body to do for the body to have spotting before menses? That's my first question. So we'll answer that first.
Yeah. So some women tend to spot a few days before the actual menstrual period. It's very common. Okay, 1 or 2 days, it's fine. If you have longer than that, then you probably need to get checked. Go and see a doctor to do an ultrasound scan. Have a look at the inner lining of your womb. Okay,
Okay.
and a few days
Okay.
is fine, but not more than that.
So when
So
you say
this,
more, like say for example, it was like a week or
that's
more
then
than a
you have
week.
to get it checked. More than a week, then it's something is wrong because it's not normal. Okay, so these
Okay.
women may have like endometriosis, even polyps like growth in the womb, in the inner lining of the womb, which need to be
Mm.
resected or surgically removed.
Okay. So that means even if say they have spotting for like say a week and then after that they have their menses, that's still immediately after they have their menses, that's still considered normal, right, doc?
One week again. One that.
So like say so the one that this is actually asked for a friend, right?
Hmm.
So she has her period, but just before the period, which is the normal kind of period, she has spotting for like a week.
I think she should get it checked.
Mm.
Too
Okay.
long, too long spotting is not common. Okay, and she may have certain things on the cervix or womb lining which has caused her to have that. Couple of days
Okay.
is fine.
Okay. So then it
Mm.
brings me to the next question. So that if
Mm.
any girl out there, what kind of checkup the happens for this kind of what kind of checkup happens? Will
Okay,
something go through or yeah?
yeah, unfortunately, yes. Okay, so there are few ways how we check for endometriosis or any gynecological problem. The first way is we'll palpate the tummy. We look for any swellings or masses. And then the second thing we use is the ultrasound machine. There are two
Mm,
ways how we use the ultrasound machine probe. One is the abdominally over your tummy. Okay, where we put some gel over it and then we will move the probe over your tummy to have a look at the inner lining, the womb, the ovaries, your womb itself, and the surrounding structures around it. Okay, and
mm-hmm.
for women who have already had intercourse before, or those already married, and then we do use a transvaginal probe, where you put in a probe from below, and then we can examine your ovaries, your womb with more clarity. The best way to examine the womb and ovary is by a transvaginal probe. Okay.
So something has to go through. Okay. All right.
Yeah, and then subsequently you can do things like pap smears. Pap smears is to check your cervix. Okay, not only check the health of the cervix, but also look for things like infection on your cervix or in vagina. If you have anything like bacterial vaginosis or candidiasis, okay, certain types of infection can also cause this prolonged spotting and all. Right?
Okay.
Yeah.
Well, since you mentioned that, because Dr. On Call, they do have like something called the Evelyn brush, where you can actually do like a pap smear on yourself. So how
Yeah.
often should a girl go and do a pap smear in their life?
Okay. Well, our government has certain guidelines. Okay, where you should do a pap smear below age of 50 at least once in 3 years. Okay.
Okay, once in 3 years. Okay.
However, if you have the high risk HPV, human papilloma virus, on your cervix, okay, we can detect it too on a pap smear. And then it's always recommended that you can do a pap smear on a yearly basis, because what you want to detect is the early changes on your cervix, which you can, once you detect it, you can resect it and you will prevent yourself from getting cervical cancer. Must always understand cervical cancer is totally totally preventable. Okay, that's one cancer which is totally preventable, because if you detect the small early signs known as precancerous cells, you can completely treat it.
Okay.
Mm.
Just a question, Doc. I mean, like with cervical cancer, can it be detected also in blood work, or it has to be through the probe or
Through
the
the
even
pap smear.
the pap smear?
Yes,
Okay.
because the probe,
Okay.
you can't see small cells on the probe. Okay, well,
Mm,
it's a pap smear, or known as a liquid-based cytology, when you use a brush on the cervix, and then you
mm,
can have a look at the cells under a microscope. That's the
right.
best way to do it.
Okay. So not even a blood test can detect that. The blood not really?
Not really. Usually, the blood test you
Okay.
can do it for endometriosis. There's something known as a
Mm.
tumor marker, CA125, that will be elevated in patients with endometriosis. So
Say again, it'll be elevated in which part of the blood
in
work?
en- in and patients with endometriosis, the CA125, this one tumor marker, will be elevated. Mm.
Okay. Okay. Well, coming back, sorry, we went to a little bit over on that one, but coming back to endometriosis, so the markers can be actually detected in blood work. Okay, that's a good thing to know. Let's take another question here from Facebook. This is from Sally Ibrahim, and she says, "Does it affect in the long run for giving? Does endometriosis affect giving the chances for fertility?" I think you did mention that, right, Dr. Navdeep?
Yes, 30 to 50% of women who have endometriosis also have
Mm,
fertility issues. Okay, the reasons being is that when you have these cells growing outside your womb, and then that causes a lot of additions, things getting stuck outside. So a fallopian tube can be obstructed, blocked, so the eggs can't go into your fallopian tube and meet the sperm. So that will
mm,
cause the infertility. Secondly, when you have huge endometriotic cyst, growths on your ovary, that will reduce the number of eggs that you have, and even the health of the egg, the quality of the egg too tends to deteriorate. Okay,
mm,
so endometriosis also it will affect the inner lining of the womb with some immune problems that can occur, reduces the receptivity rate of
mm,
the baby. So that's the main cause of endometriosis, with when causing infertility. However, as I mentioned earlier, it can be managed, and lots of patients with endometriosis have delivered many babies. So don't despair. There's always a treatment available.
Okay. Can I just ask, out of curiosity, right, Doc? I mean, with the treatments that's available for endometriosis, actually, what are the treatments for endometriosis?
Okay, so basically, it all depends on the patient's age and what she wants, whether she wants fertility or she just wants, you know, manageable periods and less pain. Okay, so the first thing that usually doctors start the patient with is the painkillers. Okay, these painkillers, for example, like Ponstan, Celebrex, lots of brands out there, known as NSAIDs.
Mm,
The women take it just about time when you're going to have their menstrual cycles. They feel the pain coming, then they start taking it. Okay, until their periods are over, and it's only a symptomatic relief. The other ones are like the
mm,
oral contraceptive pills. When you take these pills, generally your periods will be lesser, less painful, manageable. And sometimes what we do is we give the pills for 3 months in a row. So you only bleed once after the 3 months. So that also will
I
reduce
see.
your pain. The other
Mm,
things would be like injections known as GnRH analogs, where when you take these injections, you go into a temporary menopausal state. Okay, only for a couple of months, and that will reduce your periods, and you have no pain at all. However, if patients who want who have severe pain, severe big huge swelling, then we tend to do surgery for them. The
mm,
first surgery will be laparoscopic surgery, where the keyhole surgery. Okay, we poke in 3 holes with your tummy, and then we will cut off the endometriotic cyst for you, and everything's
okay.
recorded on the CD. You actually can look at your whole surgery later once you've recovered.
Oh
And
my.
the yeah, the other things would be more severe type of rather aggressive type of treatment would be like removal of your womb or ovaries. But this generally is done to patients who are the older age group, who have no plans to having children anymore. Okay, and that's the definitive way of treating endometriosis. In patients who are keen to have fertility treatment, what we do
Mm,
is we tend to do things like we give them these fertility drugs like clomiphene citrate or letrozole to grow the eggs and tell them when's the best time to have intercourse. Or we do
mm,
things like IUI, intra insemination, where we inject the husband's sperms into the womb, okay, to increase their chances. Or the best way is an IVF, in vitro fertilization, also known as test tube babies. Here
okay.
we can go to the eggs and pick up those eggs and fertilize them in the lab, and the babies we can place it into the womb. Okay, so we have no issues with the fallopian tubes and all. So there are
Mm,
many
okay.
ways. All depends on what the patient wants.
Okay. So let's just say a person is trying to actually no, let's answer a few more questions. I'm glad the questions are coming in. I'll save my
Yep.
questions for later. All right, this is from Anita, and she says at stage four is hysterectomy the only solution, and could I still be in pain after? I'm not too sure what she means by stage four, doc.
Yeah, stage 4 is extremely bad, severe endometriosis where you have cyst and everything is stuck. The womb, the bowels, everything is stuck. Well,
Also
to
different
be very
stages. Okay, all right.
yes, to be very honest, the hysterectomy, removing the womb and ovaries, it's a definitive type of treatment for endometriosis. Generally, those patients should not have any more pain thereafter. However, in some patients who have a little bit of that endometriotic foci or a little bit of ovarian tissue stuck here and there, then those
Mm.
patients will still tend to have a bit of pain. Secondly, as I mentioned earlier, in patients with endometriosis, they have things called adhesions where the bowel gets stuck and with the womb and all. And those adhesions itself can cause a lot of pain, known as adhesion colic. So as your bowel moves around, it gets stuck in these adhesions, and some patients will still tend to have a little bit of pain. Okay,
Mm.
so but generally speaking, yes, hysterectomy will relieve you of all the pain and suffering you had with the endometriosis.
But hysterectomy is where you take out completely the whole womb, right, Doc?
Correct, yes. So it's very aggressive.
Yeah.
So that should
And
be the last choice of treatment.
okay, so just to answer your question, right, Anita, because you're asking whether it's the only solution. So I think, doctor, it's not entirely the only solution, right?
Yes, not entirely. So sometimes
Okay.
what we do is we give them injections, something called like Leucrin or GnRH analogs, where you put you into a temporary menopausal state. You can take it up to
Mm,
about 6 months, up to 1 year too, and that can suppress your hormones, and you won't have your menses, and you won't have pain, which is related to the endometriotic cyst at all.
which then I would want to ask a question because of that type of painkiller, right, doc? Would it affect the child at any point? As in, like, because I know certain medications they say that best not to take it when you're pregnant. I mean, this is the one where you're trying to get pregnant. So would this kind of medication, would it have any side effects on the kid,
Not
on the
really.
baby?
Not really. It'll just like certain of these injections, you can't get pregnant at all. So it'll put your
Mm,
hormones to sleep. Hence, you won't be ovulating. You won't have your regular cycles. So,
mm,
well, it'll just prolong your infertility if you plan to have a child, but it will not
right.
affect your child in any way, unless you take
Okay.
some olden type of medication known as danazol. Danazol is a different type of medication which is which not many people use it anymore. Okay, I've
Mm,
never used it before. So,
okay.
so generally, all the medicines that we have right now is pretty much quite safe. Yeah.
Okay. All right. There's another question from Putri on Facebook. She says, um, okay, she puts there, how can she prevent from bleeding happening?
Hmm.
Because she put, bagaimana untuk mencegahnya daripada berlaku pendarahan. So I'm not too sure what you mean by
Yeah.
that.
Pendarahan dari mana? You know,
Yeah,
is
Putri
it the
boleh,
menstrual blood?
yeah, Putri boleh kamu lebih clear on your question.
Yeah.
Where is the blood coming from? Is it
Uh,
from your menses or is it from
the
dari mana the
endometriosis.
pendarahan? Yeah. Okay.
Well, well, generally,
We'll move on to another question first
if you
for
want to
that.
prevent, if you want, well, I think what you meant was how to prevent um, too much of bleeding or something. Well, generally, patients who have too much of bleeding due to endometriosis or any hormonal abnormalities, we give them some hormone treatment, like the oral contraceptive pills. That will help regulate the cycles and make it less painful, less flow, okay, and not too much of bleeding. Lah.
Okay. All right. So we'll move on to the next question. If Alia, Putri, if you happen to want to clarify in a bit, yeah. So you can just type it. This is from Izati. She said, is IVF the fastest, easiest way for endometriosis patients to have a baby?
Yes, the answer is correct. Yes, IVF is the fastest, best way for not only patients with endometriosis, but every woman to get pregnant. Because endometriosis, IVF is a treatment where we retrieve the eggs and fertilize the eggs in the lab, and straight away we have the embryos, and these embryos we place into the womb. Hence, it's the highest success rate when you look at all types of other modalities.
Okay. This is from Chan Pek Yin. What are the impacts of taking the temporary menopause jab or hormone pills to control the menses?
The the impact it's all temporary, only until you take the medicines, and they all go off later. So these injections, jabs, which cause you temporary menopause, if you take it for too long a duration, for example, more than 6 months, like you can get brittle bones, known as osteoporosis. Okay, you have vaginal dryness. When you have sex, it's painful, dry skin. So generally, we doctors prefer to give it about 3 months, if at all necessary, or we like to give a tablet. It's like a hormone pill known as Visane, which has less effect to the body. But so being a tablet form, it's much more, patients be much more compliant to it, and these tablets too. Especially for patients who are not keen to have a pregnancy. So just say when you're younger age, you find that you have endometriosis, you can continuously take this tablet, and this will prevent the endometriosis from progressing. Okay, until a time when you're already ready to get pregnant, and then you can stop the medication. Okay, so in short, long-term side effects, none at all. They are quite safe.
Okay. And the next one is from Sharin. She wants to know when she says her periods are coming every week and they last for 3 days. Oh no, she's asking why does her period last only for 3 days, I think.
So it comes every week and for 3 days.
Oh,
Well,
every week and for 3 days.
every week for
Okay.
3 days. Now that's something very abnormal. Okay, so you have to get it checked. See your gynecologist. Okay, and they'll do the scans, and they'll check inside to have a look at what's going on. Okay, it can be things like, for example, I mentioned just now, fibroids, polyps, endometriosis, or even infection. Okay, get it checked, and you can get it treated immediately.
Okay. Doc, I know this is going out from endometriosis, but just can you give a very quick summary? What is polyps and fibroids, right? You said?
Fibroids, yeah.
Yeah, what are
Fibroids
those
and
two?
fibroids and polyps are benign. That means non-cancerous growths in the womb. Okay, so some women tend to have these kind of little small growths of polyps growing in the inner lining of the womb, making the womb very irregular. And so these women tend to have pain during the menses too, and a bit of prolonged spotting, and even at times heavy bleeding. Fibroids, on the other hand, are much bigger usually. Okay, they also make the womb lining and the outer lining of the womb deformed. Okay, so it can grow. It can be as small as a peanut to as big as a football. Okay, and they too also they too can cause infertility. And sometimes some women have one, but some women have 20 of the fibroids in one little womb. Have 20 fibroids, so the womb really looks very abnormal. Yeah, but thankfully all these things are treatable. You have to do a certain surgery to get them all removed, and then your problems will be, won't be there at all.
Okay. So with polyps, because you said that is growth of tissue growth, right? So
Mm.
can that also be mistaken for endometriosis?
No, polyps, endometrial polyps and endometriosis are totally different things. So when
Okay.
you do an
Just so
ultrasound,
yeah.
you do an ultrasound scan. Okay, the doctor can actually look at the small growths in your inner lining of your womb. Now, those things are polyps. However,
Okay.
endometriotic cysts are like growths outside your womb lining, or rather outside
Okay.
your womb,
Got
in
it.
your pelvis, or on your ovaries. Okay, you see an actual growth, small little round, ball, okay, growing on your ovaries.
Okay. With polyps, basically is removal again, right?
Yes.
How does that form? Polyps, how does it form inside the uterus?
As your womb lining thickens during your menstrual cycle, some parts of the womb lining persist and start to grow more than the others. So then you'll see a small little growth over there.
Okay.
So
Okay.
most of the time you need to, get. It doesn't cause any problems, but certain patients have bleeding, infertility, pain, yeah, difficulty in conceiving. Some of them.
Okay. All right. Just letting you know, ladies, okay, if you have more questions, please keep them coming. It's great to see them. And if you are curious for yourself on whether you may or may not have endometriosis, just go on to the Doctor on Call website and then do the quiz over there. So it's an endometriosis quiz. So it'll give you a better idea. And then from there, you can go ahead and make an appointment if you need to really get a proper consultation. Okay, you'll be getting a free consult with a specialist. So the link is in the description. You just need to go and click on that, or if you want, you can just hit straight to the Dr. On Call website. Okay, the link will also be provided. It's in the description, but it will also be reshared again in the comments. Which, coming back, we're going into the comments again. This got another question here. Just letting you know, ladies, we have about another 15 minutes or so left. So just keep them coming, because you have Dr. Navdeep here. Ask as many questions, milk it as much as possible. Okay. All right.
Sure.
The next one is from Zuriatina, and she asks, can someone who have endometriosis with both fallopian tubes get pregnant naturally? Is there treatment for blocked tubes?
Okay, the first answer to the question would be no. If you have blocked fallopian tubes, then you cannot get pregnant naturally, because it's like a roadblock. The egg cannot meet the sperm, so they can't get fertilized. And yes, of course, there are surgeries which you can do to unblock the tubes. Okay, so first you have to find where the blockage is and what is causing the blockage, because sometimes it can be due to the adhesions caused by endometriosis, where you just have to cut them out, snip them out, and the fallopian tubes will be open again. Sometimes it can be due to scarring the inner lining of the fallopian tube. Now, those type of problems will be very difficult to treat, and generally speaking, these patients will have to do IVF to get pregnant. And
okay.
because in IVF, we don't have to go through the fallopian tubes at all. We bypass the fallopian tubes. So IVF is a method of choice in this kind of patients who have fallopian tube blockages.
Okay. I hope that answers your question, Zuriatina. And from Siti, she says, is there any daily routine activity to reduce pain due to endometriosis?
Yes, a lot of people have spoken about lifestyle changes, alternative medicine. Okay, one of it is exercise. Okay, when you do exercise, jogging or doing something, you tend to become healthier. Your mind gets diverted away from the endometriosis and certain pains which is related to it. Okay, so and certain types of multivitamins too, like B complexes, they claim that it can also help in reducing your severity of the pain. So yes, you should not sit down, and not do much, but you should exercise, and don't have to hit the gym. You can just go around your taman, walk around, do brisk walking. That's more than enough. Okay, sweat it out, because you must understand that you have to be healthier. And that will help you to become, when you're healthier, you feel much better with yourself, and you won't be affected very much by all this endometriosis and all. But of course, first of all, you need to get some medication and some doctor's help too.
Okay. The next question. Oh, actually, that's the same question here, which was on about the fallopian tubes being blocked. Okay, no, we do have one more here. This is from Vali, and she says, "Hello, doc. What causes endometrial hyperplasia? Is that the same as what we've been talking about? And can it be treated?"
Okay, endometrial hyperplasia is basically a condition where the inner lining of the womb becomes very, very thick. Okay, so the womb lining goes through many phases. Okay, one, it increases during your when you have your just before ovulation, and once you have ovulated, then it changes to a certain time. However, in some women who do not bleed, who do not have their regular cycles, that they don't have periods for 2 or 3 months, for example, like patients with PCOS. Okay, these women have very high levels of estrogen in their body. Okay, so their womb lining becomes thicker and thicker. Up to a point, they tend to change in its characteristics, where it becomes hyperplasia. Hyperplasia is something which is not very healthy. Okay, it can go from simple hyperplasia to complex with atypia, and eventually, if you don't get it treated, become cancer of the womb.
Oh, okay.
Okay, so patients with simple hyperplasia, the best thing to do is basically hormonal therapy. So how we detect it is by doing a DNC, where we scrape the womb lining, we send the tissue to a lab for an assessment. All right, then we give them some tablets for them to get their regular cycles and to ensure that their womb lining is thin, and that will prevent them from having hyperplasia again. And the best deal will prevent them from getting cancers in future.
Okay. Okay. Doc, who is in the high risk group for endometriosis? I'm actually curious. Like endometriosis, I think you even mentioned like as early as 11 years old. Is there an age range for endometriosis?
Not really. Endometriosis starts when you have your increase in your hormones in your body, the female hormones called the estrogen. Okay, so if you have family predisposition or certain immune system or hereditary, problems which will cause you to have increased risk, yes, then it'll start from there. Okay, but then again, we cannot predict who, but certain statistics have shown women who are obese, okay, women who are taking lots of hormonal tablets with a lot of estrogen and all, or patients with yeah, I mean these the women have increased in risk, but end of the day, it's not necessarily so that you're obese you have endometriosis. You see, okay,
Sorry, okay,
so it's not
what?
necessarily that if you're obese that you have you will have endometriosis. Okay, so we cannot predict who. That's the problem.
Okay. So that's the problem. Even like before you said, it's so hard to predict whether you have it or not to begin with, and so it's hard to prevent.
Yes, correct. If you can't predict something, it's hard to prevent it. So
Okay.
so if you have certain symptoms, it's always better to get it checked and get assessed first. So doctors can give you tablets, medication, which can prevent its progression.
How long? I mean, it depends from person to person, but how long does it take for the symptoms of endometriosis to be not in your body anymore? That's one. And then how long will it take for it to be completely gone? Please don't tell me it's a life thing.
Okay. Well, endometriosis unfortunately can't be 100% treated. Okay.
Okay.
So once you have it for life until you attain menopause. Okay, menopause is when you don't have any of the female hormones, estrogens anymore, causing you trouble. Okay, and but however, it just can be managed by certain ways depending what the patient wants. Okay, so they have tablets. For example, I mentioned the Visan tablets, which you can just take it over long periods of time. That will reduce the progression and and you get good symptom relief with that.
Okay. Doc, not just don't mind me asking, right? I mean, like, because you said that it has to do with hormones too. So, I mean, it sounds so closely related with PCOS, which is a hormone imbalance. But I'm assuming that it does play a part when your hormones are imbalanced. Um, Seriously, can it not affect a person to get endometriosis?
Well, your question was, I mean,
Sorry, let me rephrase. Okay. With
I
hormone
understand it.
imbalance, right? Hormone imbalances, can that actually cause endometriosis? Because you mentioned that once your womb is gone, I mean, technically, when you hit menopause, there's no more hormones already, then you won't have the issues of endometriosis. But you also did say it's hereditary. So doesn't that also mean that it could be a hormone imbalance that causes endometriosis?
Okay, no, not true. Endometriosis is
Okay.
not caused by hormone imbalances. Okay, but
Okay.
in other hand, PCOS, yes, that you have lots of hormonal imbalances. That's why the women they do not get their periods regularly. They do not ovulate, and even those women tend to not have fertility issues. Okay, so just like endometriosis, PCOS is something which once you have it for life until you attain menopause. Okay, and it's the similar things that there's no 100% treatment to it, but we can manage it with certain type of medication which can elevate the symptoms like
Oh, okay. All right. I have a feeling the line just dropped a little bit. But okay,
oops,
any case. Okay.
hello,
Hi, Doc. Are you back on? There seems to be a
hello.
bit of a lag.
I think we a bit of lag and a bit of glitched. Both of us disappeared for
Yeah.
a while. No mind, don't worry, we're back.
Okay. So you were saying that a hormone imbalance is usually for PCOS and not endometriosis.
Yes, correct.
Okay. Okay. Since we're talking on that, let's address some of the myths. Like, what are the myths that you have heard in regards to endometriosis, Doc?
Okay. Myths I've heard is it's caused by eating too much of chicken.
Really? Okay.
Yes, it's
Well,
quite
I
funny.
mean,
Yeah.
if anything, if say you eat a lot of chicken with antibiotics inside, then I'm sure it'll
Yeah.
cause a different kind of issue. But I think chicken in general,
Yeah.
if you say you're eating kampung chicken,
Very
I don't think
safe.
it would. Yeah, in fact, I
I
think
don't
it's
think
even better that you eat more kampung chicken.
I don't think it'll cause endometriosis at all. I just remember this
Yeah.
patient of mine whose mother was there. Yeah, because my daughter eats a lot of chicken. That's why she got that. I said, no, auntie, it's not because of
Wow.
that.
Mm,
All right. The other things is like when young girls have their menstrual pains, okay, and it just passed off
mm,
as it's something which is regular, that's normal for every woman to have. I think that
mm,
is the biggest problem where because of that, these young women they tend to seek medical help later in their lives, and it just delays the diagnosis. From the
mm,
time when they first have the symptom of any pain, it takes 8 years eventually for them to get treated, for them to actually get diagnosed, because first it's passed off as something normal. Then the disease progress gets worse and worse and worse. So it's always
mm,
better when your daughter or your young child or your young women, who have pain, severe pain during menstrual periods where you have to skip school, take MCs, take lots of painkillers, just go get it checked. You never know, you may have endometriosis, and the doctor might give you treatment to reduce its progression, and it can
mm.
save you a lot of hassle in future.
Okay. So two myths already so far. One is eating chicken will cause that, and then the other one is talking about making not a myth, but more so of just making the pain we talked about earlier, making the pain very normal. So I think it's most important for a lot of girls out there. If for moms, you could also make it teach your kids how to be aware. I mean, your daughters to be aware with their bodies. I don't know, like when would it be the right time? I suppose when the girls have their menses, that'd be a good time to actually just start explaining to them like what is a normal healthy period, so they at least
Correct.
know when what to expect. And because even like for me, doc, just letting you know, I went through a phase where even I didn't know, and my mom also didn't know of how to handle things when I was actually bleeding out for 3 months. So that's a completely different story, which I've shared before. Yeah, so I think it's just really important that girls, you need to be aware of your body and not think like it's normal or anything like that. For one, to have pain constantly or just to be in severe pain. Yeah, your body shouldn't be in severe pain all the time.
Correct. It's a sign. It's a red flag saying that look, there's something going on, and you have to get some help, seek some advice, consult a doctor. Okay, that so at least can alleviate your pain.
Mm, yeah. So, okay, guys, if you ladies, if you do have any more questions, please keep them coming. We have about another 5 more minutes left. In the meantime, just a reminder, do check out the link, which is on the description. And that's for the Dr. On Call website, where you can do an endometriosis quiz and then followed by getting a free consult with a specialist. Okay, so Doc, any more myths? I kind of like the myth examples. Like, is there any more chicken type of myth, or is there?
No, that's about it. Yeah, there's
Okay,
no other myths.
okay.
Hmm.
So maybe we can come to a conclusion, right, Doc?
Hmm.
So we've already addressed the myths. So okay, we'll go from the top. So endometriosis is basically tissue cells from similar to the uterus, which is happening on the outside of the uterus, and if you have things, for example, the symptoms, which is severe pain, the spotting, the fatigue, and any other ones that I missed out, Doc, for
That's
endometriosis?
about it. Yeah,
Three.
fertility.
And fertility. Okay, well, that one's
Hmm.
kind of hard, but I think the most immediate one is the pain, right? You mentioned.
Oh yes.
Um, yeah. So the pain and the spotting and the fatigue. When you say fatigue, right? What kind of level of fatigue are we talking about? Because I feel like everybody these days is fatigued out because they have lack of sleep. But what is the level of fatigue that we're talking about here?
Well, I think the level is different from person to person.
Yeah.
Generally speaking, it's like if you have lots of bleeding, you heavy flow, you have heaviness in your lower part, your tummy, you feel generally very tired and not out of energy. So yeah, that actually can occur commonly in a lot of women. Okay, but if it's very severe, then it's something which you need to, as I said, get checked. Anything which
Okay.
is severe, where you cannot do where it affects your quality of life. You're supposed to do something, and just because you have your menses and have certain thing happening, pain, then it disrupts your usual flow in your life, your routine work. Okay, then
Yep.
you better get it checked.
Okay. So do get yourself checked, ladies. And then the other part is let me see, what was the other thing that I wanted to wrap up on the tips? Anything to do with when you're having pain. I really like the one tip that you're saying, Doc, that which is to keep an active lifestyle. That's so interesting that when you actually have the pain, you should be moving. Doesn't have to be a full-blown workout, at least moving in some way, and that will actually mitigate the pain.
Yes, of course. You have your blood circulating. You're in an environment. You're looking at the surrounding. Okay, and you're trying to basically divert your attention to other things, and that will make you feel much better and definitely improve your quality of life.
Okay.
And
So,
for
okay,
lots of
Doc, with
women,
that,
you end up losing weight. And when you see the weighing scale going lower and lower, that itself will make you feel better.
so in conclusion, Doc, what can we say for endometriosis to all the ladies out there who may have it, already have it, and want to prevent it? Well, we already mentioned that
Well,
it's hard to prevent, but yeah.
number one, get checked. Okay, number two, it's treatable. Okay, and number three, you don't have to suffer in silence. If you have pain, just go and see a doctor. Seek some form of help. That's it.
Okay. And once again, ladies, you can actually do check by going to the Dr. On Call website. Again, that is where there is a quiz on endometriosis. I'm going to do it myself too, just because. And then you can get a free consult with a specialist. Okay. Thank you all so much for all the questions. That was really, it was really good. And Dr. Navdeep, thank you so much for having this chat with me and together
Thank you
with
very much.
Bayer, TMC Fertility, and the Asian Parent, and of course the Doctor on Call for setting this whole thing up. At least now I know a lot more about endometriosis, and hopefully I never get it.
Yes,
It's already
hopefully,
enough
yeah.
headache as it is. Yes. Well, I would like to think so. Yes, it's already a big headache with life as it is. But thank you so much. And Doc, where can people find you online?
Well, basically, I'm in TMC Fertility Center in Puchong. You can go to our Facebook page or even our website, tmcfertility.com, and you can find me there.
Okay.
You can
Thank you
contact our
so
care
much.
line, and then I can answer your questions too.
Okay. Thank you so much,
Okay.
Dr. Navdeep. All right,
Thank you
guys,
very much, Laura. Thank you very much.
that's pretty much it for the entire day, and thank you this 1 hour session. And who knows, we may be having more in the future, not just on endometriosis but other things together with Dr. On Call. So thank you so much everyone for joining in, all your questions. Have a wonderful evening. Once again, my name is Linora Low, and it'll be a pleasure to speak to you again next time.
Okay.
Bye
Thank you
everyone.
very much, and